Before administration, all plasma products must be tested for which of the following? A. ABO compatibility. B. RH compatibility and ABO compatibility. C. RH compatibility. D. None of these are correct. The answer is B. RH compatibility and ABO compatibility. Before administration, plasma products must be checked for ABO compatibility and RH compatibility. ABO blood type does not have to be an exact match, but blood types must be compatible. An RH positive individual, for example, is compatible with either RH negative blood or positive blood, while an RH negative individual is only compatible with RH negative blood. A nurse is performing standard cardiac auscultation on a 47-year-old male with normal heart size. Where would the nurse listen to evaluate the pulmonic valve? A. The second left intercostal space. B. The first left intercostal space. C. The first right intercostal space. D. The second right intercostal space. The answer is A. The second left intercostal space. The pulmonic valve can be auscultated to the left of the sternum at the second intercostal space. Auscultation at this space can aid in the identification of pulmonary murmurs such as pulmonary stenosis or regurgitation. The second right intercostal space is the location at which the nurse would be able to evaluate the aortic valve. The first intercostal space is not generally auscultated in a normal heart exam. A nurse is performing standard cardiac auscultation on a 47-year-old male with normal heart size. The nurse pauses to listen at the fifth intercostal space on the left midclavicular line. The nurse is evaluating which of the following? A. The mitral valve. B. The pulmonic valve. C. The tricuspid valve. D. The aortic valve. The answer is A. The mitral valve. The fifth intercostal space on the left midclavicular line is the best location from which to evaluate the mitral valve. The other heart structures are paired with locations as follows. Aortic valve, the second intercostal space right of the sternum. Pulmonic valve, the second intercostal space left of the sternum. Tricuspid valve, the fourth intercostal space left of the sternum. A nurse administers 1 unit of packed red blood cells. 4 to 6 hours later, what change can be expected in the patient's hemoglobin levels? A. 5% decrease. B. 3% increase. C. 20% increase. D. 15% increase. The answer is B. 3% increase. A nurse should expect to see an approximately 3% increase in the recipient's hemoglobin 4 to 6 hours after the administration of 1 unit of packed red blood cells. Which of the following has been removed from washed red blood cells? A. Plasma. B. Antibodies. C. Platelets. D. All of these are correct. The answer is D. All of these are correct. Washed red blood cells are the product of blood that has been stripped of plasma, leukocytes, antibodies, cytokines, and platelets, in addition to any other blood proteins. After thawing, fresh frozen plasma must be used within which of the following time frames? A. Within 12 hours, if refrigerated. B. Within 24 hours, if refrigerated. C. Within 30 minutes, refrigeration is not advised. D. Within 2 hours, if refrigerated. The answer is B. Within 24 hours, if refrigerated. Whenever possible, fresh frozen plasma should be transfused immediately, or as soon as possible, after thawing. However, if this is not possible, it may be refrigerated for as long as 24 hours after thawing. Which of the following laboratory values is not reported in a basic metabolic profile, BMP? A. Sodium. B. Blood urea nitrogen, BUN. C. Phosphorus. D. Creatinine. E. Potassium. The answer is C. Phosphorus. A BMP is a commonly ordered lab value set on patients. It checks commonly reported electrolytes in the body. It is also known as a Chem7. It looks at sodium, potassium, carbon dioxide, bicarbonate, blood urea nitrogen, BUN, creatinine, and glucose. Phosphorus is not included in this laboratory order, and must be checked separately. A nurse is reviewing labs for a 68-year-old female. Lipid testing revealed a total cholesterol of 230 mg per deciliter. This patient's cholesterol level would be defined as dash. A. Normal. B. Low risk. C. Moderate risk. D. High risk. The answer is C. Moderate risk. A total cholesterol over 200 mg per deciliter is considered a risk factor for cardiovascular disease. A total cholesterol level of 200 to 240 mg per deciliter is considered moderate risk, while a total cholesterol of over 240 mg per deciliter is considered a high risk for cardiovascular disease. This patient's total cholesterol is 230 mg per deciliter, which would place her in the moderate risk category. Which of the following might be a sign of a transfusion reaction? A. Pallor or cyanosis. B. Urticaria, itching, or swelling. C. Myalgia, tingling, or numbness. D. All of these are correct. The answer is D. All of these are correct. Common signs of transfusion reaction include urticaria, itching, or swelling, pallor or cyanosis, anxiety, and myalgia, tingling, or numbness, in addition to diaphoresis, tachycardia, headache, and gastrointestinal distress. Droplet precautions are designed to stop the spread of infectious diseases that travel through droplets. These droplets may land on the mucosa of the nose or mouth after a host sneezes or coughs. Which of the following conditions does not require the use of droplet precautions? A. Influenza. B. Varicella. C. Rubella. D. Mumps. E. Pertussis. The answer is B. Varicella. Varicella requires airborne precautions. Staff caring for patients with varicella should be immune. One's immunity to varicella can be confirmed by a blood test.